working conditions, and lack of quality and adequate personal protective equipment. Nurses and clinical officers are currently on strike, and President Uhuru Kenyatta has been quiet over the ongoing crisis in the health sector. At the Nyayo National Stadium during Jamhuri Day celebrations, Kenyans waited for the slightest hint of hope as the president addressed the nation. President Uhuru Kenyatta brushed over health and COVID-19. On an issue that affects millions of Kenyans, it may not have been given the attention it deserves. In his 5,687-word speech, Matters Health got 8.8% of his attention in just 498 words. Kenyatta outlined the progress in the fight against COVID-19, the increase of infectious disease ICU beds from 8 in March this year to 827, to the availability of 20,910 isolation beds. He paid tribute to health workers.
As I have said before, and I will never tire in thanking our healthcare workers for their dedication and selflessness.
The head of state focused on issues that may be important but not crucial in the midst of the COVID-19 pandemic. The nurses and clinical officers strike is now in its 6th day. The president only had a painfully vague promise.
Building a robust healthcare infrastructure at the county level has to go hand in hand with protecting our health workers as well. And indeed, my government is working on this.
With COVID-19 numbers on the rise and concerns over the lack of PPEs worth over 5 billion shillings are lying at the KEMSA warehouse. And for a man keen on fighting corruption and protecting health workers, the president has been quiet. But the president's inaction on a health crisis may be nothing new. In December 2016, doctors went on strike. Court directives were ignored and mediation talks failed. The government at one point pulled out of negotiations, and the president lost his patience with the doctors.
Mimi nawauliza murudi kazi, mkikosa kurudi kazi ni nyumbani mutaenda na tutatafuta madaktari wengine.
A return to work formula was finally agreed after 100 days, ending one of the longest industrial actions in the country. Doctors issued a 21-day strike notice last month, but suspended it to pave way for negotiations. Nurses, on the other hand, made good their threat to go on strike. It is not the first time they are going on strike during President Kenyatta's tenure. In April 2015, nurses went on strike. In July 2017, again, they went on strike. Now, they are at it again. Same old concerns, poor working conditions. The government has in the past not entirely honored its promises to nurses. How the government plans to protect health workers and how long it will take to work on it will shape the industrial action by nurses, which has disrupted health services in public hospitals across the country. And in the midst of the COVID-19 global pandemic, the president's silence is rather too loud. Rita Tinina, KTN News.
So let me begin with you, Kipchumba, and Rita put it quite aptly there. Just 8.8% of the president's speech focused on matters health, 498 words only. What is your take on that thought that he did not give the health situation in the country the attention it deserves, that he glossed over it?
I think there is a problem with our constitutional structure when it comes to dealing with healthcare. When we devolve the workforce to the counties and left policy at the national level, that is where the problem is. We do not have a neatly held fabric between national government and county government. So each part of government leaves things falling through their fingers. And I had hoped and believed that the BBI, as unconstitutional and incompetent as it is, would have looked into the issues of the healthcare and do something like a health commission so that the healthcare and the whole sector in the healthcare industry can be streamlined and be put under an institution. Because what we have currently is a blame game. The national government is saying we devolved healthcare. But here we are having things, and we are in the midst of a pandemic. My thought will have been that the president will have given us a way forward in terms of the issues of releasing money to these health workers, because then these things have been there. We've talked about, I think this is the third or the fourth year we are addressing the issues of healthcare and the issues of their employment and labor relations. I think it has come to a point where we need to see the president acting and acting conclusively. It doesn't make sense that a healthcare or a frontline worker dies while offering services. If the doctor is dying, what happens to the patients? It means that we are sending the wrong message. It is as though we are at war and we are not giving the people at the front line guns. How will they fight? So we really need to come back and even inspire hope, instill hope in these doctors, nurses, and the clinical officers, so that they can be able to understand that we are in a financial crisis. But you cannot demand them to understand the financial crisis while you are drumming for BBI, which cost 14 billion. All they are asking is around 2 billion, I think 2 point something. So look at the irony and the sarcasm around all this. And we take a presidential speech, we address BBI, things that are abstract. We talk about ICU beds. They are just beds. If there is nobody to offer the service, there is nothing that an ICU bed can help anybody. Even your bed at home can be an ICU bed, but you go to hospital because you need a human resource there. And look again, Ben, we use a lot of money to train health workers. So it doesn't make sense we train them and then we waste them in so many things. In the last 4 years, we've been in and out of strikes. There is no difference between the healthcare industry and the teaching fraternity, because we are always in circular strikes. We leave the teacher strike, we go to the healthcare strike. So I think what time has come, and you ask yourself, what do these people discuss when they go to the government, to that summit where governors and the president and deputy president sit? We need to ask them the hard questions. Kindly sit down, come up, give us the only gift we can ask Uhuru Kenyatta as we go to the December holidays is for him to put the healthcare and the health industry in order. We are no longer interested in Mutai Kagwe speeches. We want to see demonstrable work towards ending this crisis. And then we ask also the chair of the Council of Governors, giving pressers and speeches alone doesn't help. Let him demonstrate that he is sitting ground, standing at the high pedestal without coming down and meeting the people at the center. Doesn't help.
Dismas, the healthcare workers are frontline officers in this war against COVID-19, and they do not feel equipped enough. They do not feel that they are protected enough as they fight to protect Kenyans. One of the latest one to pass on, Dr. Mogusu, who died last week, had not been paid for 5 months. Do you think that the BBI, as important as it may be, is more important than this, because now we have nurses and clinical officers on strike?
Now, in my view, and after consulting political leaders and consulting healthcare leaders, one cannot say that BBI and healthcare or managing COVID are two mutually exclusive events. The two can be managed at the same time. And there's even evidence across the globe. Ghana had an election the other day with COVID. US has had an election with COVID. So really what Kenya is facing is a leadership crisis. It's a leadership challenge. We can manage to face the three elephants in the room today. That is COVID, economic recovery, and BBI at the same time, and do a good job if our leaders are committed to success, if our leaders abandon their selfish interests and pursue our public and national interests. Now, a celebrated five-star general in the US called Colin Powell said that when you send your troops to war, you must give them the necessary equipment if you expect good results. And for us, President Kenyatta has sent healthcare workers to go and fight COVID, but he has not given them the requisite tools. And in my view, when you look at the speech he presented yesterday, he scores an A in BBI, but he scores an E in COVID and an E in economic recovery. There is no way you're going to expect our healthcare workers to be happy working if they don't have sufficient compensation, if they don't have sufficient tools. And in my view, that's what he should have started with. reassure Kenyans that everything is okay in the healthcare space. Make sure that the Council of Governors or the chairman of the Council of Governors is actually having a conversation so that while we're in an economic crisis, the healthcare leaders, the nurses, the doctors, the clinical officers, in my view, are very reasonable people that if the government demonstrates goodwill, that they've gone the extra mile, but the limiting factor is resources, the healthcare workers would actually be able to understand that we are in an economic situation and there's some limiting resources. But when you abandon healthcare, the healthcare workers rather, and then you focus your speech on BBI and you focus a bit of it on economic recovery, then people back at home begin to wonder whether or not the president actually feels and understands the pains of Kenyans. Because right now, as Kipchumba has indicated, you could have so many ICU beds, you could have oxygen tanks all over. But what happens if you go to an hospital with an ICU bed and there's no medical doctor to take care of you? What if you go to an hospital for normal attention, and then the medical doctor who is coming to take care of you, or the nurse or the clinician, is actually COVID positive? So instead of going to hospital to procure treatment, the healthcare workers, because they have not been taken care of, they're the same people who are inspecting you, or rather who are infecting you. So in my view, the president still needs to come back and address the nation, because you recall when the president takes office, when he's sworn into office, he says he's going to do two things: protect lives and protect properties. So his biggest responsibility is to protect the lives of Kenyans, and the lives of Kenyans are under threat from COVID. So in my view, that's something he must revisit, so that it demonstrates that the government is actually going the extra mile, for the doctors also to see that there is much effort, but the limiting factor is resources. And also there's an issue that has been raised there, which is a fallacy. Somebody has claimed that BBI is abstract and it will not create economic opportunities for the nation. It's a well-known fact that in Kenya, out of 5 years, we spend 20% of our time planning on how to go to an election, and also spend 20% of our time asking ourselves whether the elections was free and fair. And it's a statement of fact that all over the world, any country which has got a very strong government, be it a dictatorship or a democracy, investors have got very high appetite for those markets. But for Kenya, if somebody wants to come to Kenya and invest in 2022, by mid of next year, they'll take a wait and see approach. They want to find out how is the political situation in Kenya. Then after you've gone to the polls, again, they want to see whether there's going to be any violence, whether there's going to be any protest. So as a nation, we cannot afford to be losing 2 years every 5 years because of political situations.
Yes, Kipchumba, you have 30 seconds. You need to say something.
Mokua must go back to the terms of reference that were given to the Building Bridges team. We did not appear from the bush with the BBI amendment. It came from somewhere. The reason why the two principals shook hands, they shook hands because we are told that there was a contested election. And we need to ask ourselves, the question must lead us to the answer. We cannot start from the answer going back to the question. BBI as is, I have asked even this Mokua to show me where BBI has demonstrated that if we go to an election in 2022, the loser will not cause mayhem. We need to ask ourselves some of these pertinent questions. Kenyans fight not because of elections, Ben. Kenyans fight because of the skewed resources allocation in this country. Kenyans fight because of the skewed land redistribution in this country after the Muzungu left. Nobody fights because of the colors of the ballot papers. That is normally a trigger effect. We need to be demonstrated and to be told what why, how, and when the position of a prime minister will stop people in Nyanza, in Eldoret, in Nakuru from carrying stones, and will stop a neighbor from turning to a neighbor. What brings people to fight is the same politicians who are up and down. How will we stop people from fighting by creating a position of a leader of opposition? It is not that Kenyans fight because they want to feel like they belong somewhere. No, Kenyans fight because there is a feeling that the people who go and occupy seats are the people who will eat. The tribe that has the president will receive everything. So that is what we need to work on. What in this BBI as a finality, Ben, will deny Raila Odinga from denouncing results. What we need to do is that we need to work on the software of our people. We have the hardware, the constitution, the law is there. The problem is not the law. The problem is a bad premium in our politics. The problem is bad issues of resource allocation in this country.
All right, you've taken us back. We'll come back to that in the closing remarks. But we need to end this discussion about the health issue. Let me come to you, Mark Bichacha. You touched on it earlier, and you said that the president indeed talked about the health issues. He talked about the increase in the ICU bed and isolation beds in the country. Indeed, he did talk about this. But talking to striking health workers last week, they were expecting that he would say something to the effect that that would have an effect of progressing the situation as it is, that is the current strike, and maybe changing the trajectory of the strike and them coming back to work to protect Kenyans on the front line. But he did not do that, did he?
Well, he didn't, and I've been personally racking my brain and asking around what the issues are. So, number one, there's the issue of the most of the healthcare workers are not employees of national government. 90 to 95% of them actually are employees of county governments. In fact, rightly put, the National Council of Nurses, when they go on strike, they are committing a bit of a misnomer, and here's what I mean. The nurses in Kisumu should declare a strike notice against the government of Kisumu, same to Machakos, same to Garissa, same to whichever county there is. However, when you're having a national nurses strike, just as it was in those other two times that you've talked about, it is indeed the county of the governors, the county governors, sat down with them and came up with a deal, and that's how it is now. This is a problem that is caused with how our constitutional order is put in place, and also by the fact that Kenyans have not been socialized enough to differentiate between the roles of national governments and county government. Now, that does not mean that as head of state, the president should totally ignore the issue. And I don't think he did, because in his statement, and it depends on whether you take the statements of a head of state during a national function as important or not, when he says he will continue to not only thank them, but to make sure their work environment is working better. I do not know whether if it was a bigger paragraph of what it was, then you would have taken it more seriously, because I am inclined to believe that the words of a head of state during a function such as that should be taken as something that is law. Now, of course, he cannot come out and give you a detailed plan when the negotiations have hardly started. So for me, I would take this and give it some time, give it some breath, and see what happens in the coming days, and allow the county governments to do what they're supposed to do, because that is their role. I honestly believe, just like it is in the United States, the state governors have the main prerogative, even in fighting the COVID-19 pandemic. Just like in Kenya, PPEs are procured by them. No one has stopped them from procuring PPEs outside of KEMSA if KEMSA is the problem. So we do have a problem with the county governments, and we need to settle it there. But we also need to give the president...
Indeed, health is a devolved function, and they should be focusing or addressing their grievances to the county governments. But he is the president, and it was the same when in 2016 he told the doctors to go back to work, or they will be sacked, and Kenya will look for new doctors.
One of the things I love about my president is he sometimes says things off the cuff that are constitutionally impossible. Even if he wanted to fire all of them, there is no legal precedence upon which he can do that. It is an impossibility. He can't do it. Even if he wanted to fire all of them today, it can't be done without breaking our legal system as it is. So there's no point really in discussing that, because we know he said it, and that it didn't happen. And if he tried to say the same thing, it won't happen now. But the truth of the matter is, if we are are going to solve these issues that is perennial with doctors and nurses, we have to talk about how it is devolved and what the county governments are doing. Because to be honest with you, that in as much as we want the president to speak to it, the legal infrastructure for him to actually address this issue simply does not exist. And to just remind Kipchumba quickly that the BBI has a whole section on software, it's called UTU, that is actually a constitutional referendum question that calls us to change the behavior of our leaders and our citizens in general.
All right.
So let's not ignore that.
Rosalind, have the final word on this. Do you think the president gave the health sector and all that's happening, the current strike, the COVID-19 pandemic, the attention that it deserves?
Ben, I don't think the president actually gave this entire situation the backing that it deserves. And especially when his speech was actually remembering where we are from the time of independence. Remember, we were colonized for 78 years. And when we were liberated, remember, one of the key issues that we had was disease. And it is unfortunate that 57 years down the line, we are still talking about disease ravaging the republic. And when I hear some of my colleagues talk about the buck does not stop with the president, if you look at the Constitution, the county governments and the national government are distinct but intertwined, which means they work together. If we are talking about the healthcare situation, then it is a concurrent issue, and that is why we have the national government and we have the county governments. In terms of even policy, remember we have the national referral hospitals that are still under the national government. Now, if you follow the devolution of the healthcare sector from 2013, the governors and the national government were at a standstill. One of the issues was, how do we have a seamless transfer of functions and the workers to the counties? That was a push that we saw for a very long time between the Ministry of Devolution and the Council of Governors. And it is one thing that has not been resolved to date. Another standoff that has always been there was in terms of the finances. And this has always been the bidding that comes before the Parliament and also the Intergovernmental Budget and Economic Council Committee that is chaired by the Vice President. And the debate has always been, can we get finances to go to the counties, especially for the healthcare workers? And there is no way we can talk about a proper infrastructure without having personnel who handle those infrastructure. If we talk about ICU beds and isolation wards and all that, and we don't have healthcare workers who have already withdrawn their services, how do you expect the people who need these services to get them? So for me, if you go back to the president's speech, I think he should have given it more attention than what we got, especially after my colleague Rita said that you only touch 8.8%. Surely in a country that is hailing currently with the COVID pandemic and even the other diseases that have actually been ignored because of the COVID, I think the government owes it to us. Now, if you look at the same constitution we are talking about amending, Article 43 talks about healthcare, and it says, provide the highest attainable standards to Kenyans. I think that is just one sector that can actually call for the impeachment of our leaders, because if you look at the Constitution, it talks about great violation of the Constitution and the subsidiary laws. So in this case, this is actually an article that is expressed in the Constitution. We should be able to talk about adequate health care, adequate housing and education, and we are not seeing that. So as much as the president was talking and rallying our leaders about the BBI and amending the Constitution, we expected him to take more time and talk to us about how to address the issues of healthcare workers and the issue of the entire fabric of the healthcare sector.
Thank you, Rosalind. We will continue to dig into this and dissect the President's Jamhuri Day speech here on KTN News. Let's take a quick commercial break here on Inside Politics. Don't go anywhere. When we come back, we shall be focusing on the impeachment process, rather the trial of Nairobi Governor Mike Sonko, who was impeached by the Nairobi County Assembly. The trial begins at the Senate plenary this coming week on Thursday. Is Sonko's goose cooked? Stay with us.